Almost all intensive care beds are occupied. The employees are exhausted. Belgium is threatened with a hospital emergency in the third corona wave. Now, patients are to be brought to the Federal Republic of Germany. In view of the devastating third corona wave in Belgium, the country's health ministry warned on Friday that the intensive care units would be overloaded. Around 900 of the 2,000 intensive care beds in Belgium are occupied with COVID-19 patients. Authorities representative Marcel van der Auwera said the staff in the intensive care units were exhausted. According to him, Germany agreed to accept Belgian COVID patients. The employees in the intensive care units had been given 130% for a month, said van der Auwera. The tense situation is likely to continue for 2 or 3 weeks. Because of the high occupancy of the intensive care beds available in Belgium with COVID patients, many hospitals have difficulties treating other emergencies, such as victims of car accidents. On Friday, there were only 82 free intensive care beds in Belgium for such cases, said van der Auwera. After a request from Brussels, Germany, of course, agreed to accept patients from the neighboring country. COVID patients had already been transferred from Belgium to Germany during the second corona wave in November. Despite the dramatic situation in the hospitals, Prime Minister Alexander De Croo's government is sticking to the easing of the corona lockdown planned for the beginning of May. Restaurants and cafes will be allowed to reopen their outdoor areas from May 8th, confirmed De Croo on Friday. 4 guests are then allowed per table. The easing is possible because the vaccination campaign in Belgium is progressing better than expected, they say. 2.5 million of the country's 11.5 million inhabitants have so far received at least one vaccination dose. The number of confirmed new corona infections in Belgium averaged over 3,500 per day over the past 7 days. In the Netherlands too, the clinics are so full that doctors warn of an emergency. If the number of infections does not go down quickly, there is a threat of a code black next week, said the chairman of the Association of Intensive Care Physicians, Diederik Gommers, on the radio on Friday. In the case of code black, a triage commission in hospitals has to decide which patients should still be helped. Several hospitals in the country are so overcrowded with COVID patients that the limits of their performance have been reached, said Gommers. According to the hospitals, many operations are already being cancelled, including cancer and heart interventions. The state of emergency in hospitals had not yet existed in the Netherlands during the corona pandemic. Nevertheless, the government continues to loosen the corona measures. From Wednesday, the curfew will be lifted and terraces of restaurants and shops will be allowed to reopen under certain conditions. Prime Minister Mark Rutte spoke of an acceptable risk. Due to the increasing number of vaccinations, a decrease in infections is expected at the beginning of May. In the Netherlands, there are around 280 corona infections per 100,000 inhabitants in 1 week. In Germany, the 7-day incidence is around 164. And let's keep our fingers crossed that even if there will be those openings in Belgium and the Netherlands, the numbers won't climb. And if you want to stay informed, please subscribe to my channel. Auf Wiedersehen.